Even something as simple as raising your arms above your head feels strangely hard. Then, eventually, the disease reaches the muscles in your face and throat. Your speech starts sounding slurred because your tongue and lips can't move cleanly anymore. Drinking water becomes dangerous because small amounts slip into your airway instead of your stomach. Food and saliva can get stuck in your throat because the muscles coordinating swallowing are weakening too. But the most dangerous phase of ALS is when it reaches the diaphragm, the large muscle below your lungs that pulls air into your body every time you breathe. At first, you only notice it during activity. Walking farther than usual leaves you out of breath. Later, even lying flat in bed becomes uncomfortable because the weakened diaphragm can't fully expand your lungs anymore. At the same time, your cough grows weaker too, which creates another problem. Stuff that should have been cleared out, like saliva, mucus, or tiny bits of food and water, can stay in your airway instead. Some of it can slip down into your lungs and bring bacteria with it. Over time, that can turn into pneumonia, which is when the lungs get infected and start filling with fluid and inflammation, because apparently breathing wasn't already hard enough. But even without pneumonia, the breathing muscles keep getting weaker. Your lungs can't pull in enough fresh air or push out enough used air. So carbon dioxide, the waste gas you normally breathe out, starts building up in your blood. At first, that gives you headaches, exhaustion, and brain fog. But later, it makes you feel sleepy and confused because your body is basically poisoning itself with air it can't fully exhale. Without permanent mechanical ventilation, most ALS patients eventually slip into a coma and die from breathing failure. And one of the cruelest parts is that awareness often stays mostly intact while the body keeps shutting down. So the mind is still there, watching the control panel lose buttons one by one. Doctors still don't fully know why ALS starts. In some patients, it runs in families because of inherited gene mutations. But in most cases, it appears randomly, with no clear cause at all. There's currently no cure. Most patients die within 2 to 5 years after symptoms begin, usually because the breathing muscles fail. Lou Gehrig died in 1941, less than 2 years after his diagnosis. African trypanosomiasis. Imagine you're a fisherman living near a river in Congo. You spend most mornings walking through thick brush near the water, carrying nets, swatting flies, and trying not to lose your mind every time something bites you. Then one day, a tsetse fly lands on your arm. It hurts more than a normal mosquito bite, but you've been bitten by insects your whole life, so you slap it away and keep moving. A few days later, the bite area becomes sore and swollen, and you start having a fever. At first, it comes and goes. You feel hot, weak, itchy, and tired. Your joints ache. The glands in your neck swell up. You still try to work because the symptoms don't feel dramatic enough to stop your life. But the problem is that the fly delivered very tiny and illegal passengers. The disease is